So when they leave the office, sometimes I work till 10, 11, and I'm tired because I had my date. I take a hydrocortisone. He says it's better than coffee, better than anything.
That is
But you have to
amazing.
be tired.
So you've used hydrocortisone in at least 5 patients, but also as a prescription for those starting new regimen of anabolic steroids, testosterone, human growth hormone, especially for the male, but for females too. They all need it.
Oh yeah. Female is just different dosage.
Yeah. But I've always learned that you want to do the higher dose in the morning, so maybe the 20 milligram hydrocortisone or the 10, and then in noon you give like a 5 milligram or a 10, because that's when the cortisol goes down.
I would say 10, 5, 5.
10, 5.
10 in the morning, 10 at noon. 10 in the
Five.
morning, 5 at noon, and 5 middle of the afternoon.
Yeah.
If they need it. If they don't,
But we learned at A4M that, and I think it's obvious, that you first optimize everything else. The thyroid hormone, the testosterone, DHEA, pregnenolone, estrogen, progesterone. And then you see if they are still not having the energy that they should, and they've dialed in the diet and they're fixing everything else, they're drinking electrolytes, and they're still not improved in the fatigue, then you give them the cortisol in the morning.
yeah.
Yeah.
And always get DHEA with it.
Yes, that's what we know now. DHEA and pregnenolone too.
And pregnenolone, probably.
Probably.
If they don't sleep well, I would say.
It's